Imagine being thrust into a battle on two fronts. One, a fight for your life against cancer, and the other, a fight for the best start to your child's life through breastfeeding. This is the harrowing reality for mothers diagnosed with breast cancer and prescribed Ribociclib, a drug that clashes with the natural act of breastfeeding. As medical advancements offer hope in the form of effective treatments, they simultaneously pose profound ethical and practical dilemmas. The poignant story of a mother's love, entwined with the cruelty of necessary medical intervention, paints a complex picture that demands our attention and understanding. Ribociclib stands at the forefront of targeted cancer therapies, specifically designed to treat certain types of hormone receptor-positive breast cancer in postmenopausal women. Its role as a cycle-independent kinase inhibitor disrupts cancer cell proliferation, offering new hope to many. However, the implications for breastfeeding mothers are profound and troubling due to the drug's potential secretion into breast milk and the unknown effects on nursing infants. There is a stark gap in research regarding the excretion of ribociclib into human milk. Preliminary findings suggest a high protein binding rate, which could mean significant transmission to the infant through breastfeeding. The potential risks to infants, ranging from developmental issues to direct toxicity, are deeply concerning, especially given the potency of ribociclib. This uncertainty makes the decision to continue breastfeeding during treatment fraught with anxiety for mothers. Advocating for the cessation of breastfeeding due to cancer treatment introduces complex ethical questions. It pits a mother's health against her infant's developmental benefits from breastfeeding, creating a dilemma that is as much moral as it is medical. The emotional toll on mothers who must cease breastfeeding can be severe, leading to feelings of guilt and grief. This emotional burden underscores the need for sensitive and supportive healthcare practices. Current healthcare guidelines strongly advise discontinuing breastfeeding while taking ribociclib, extending several weeks post-treatment to ensure the drug is cleared from the body. Alternatives, such as pumping and discarding milk, are often suggested to maintain lactation without risking the infant's exposure to the drug. Such practices, while practical, do not alleviate the emotional strain, but provide a functional path forward for mothers during this challenging time. Personal stories from women who have faced this dilemma bring the issue to life. For instance, one mother described the heartbreak of stopping breastfeeding her 6-month-old when she began treatment, juxtaposed with her relief at having an effective cancer therapy available. These narratives paint a vivid picture of the real-world impact of ribociclib on breastfeeding practices and maternal emotions. Experts like Dr. Elaine Young argue for a balanced approach that does not overlook the emotional and ethical dimensions of cancer treatment in breastfeeding mothers. They call for clear guidelines that are supported by robust research and empathetic counseling. The consensus among healthcare professionals underscores the complexity of the issue and the necessity of an individualized approach to each case. There is a pressing need for targeted research to understand how ribociclib affects breastfeeding and to develop safer protocols. Such studies could revolutionize treatment guidelines and significantly alleviate the concerns of breastfeeding mothers. Future research could also explore the timing of drug administration relative to breastfeeding, potentially allowing mothers to continue nursing safely. Innovative approaches, such as scheduling breastfeeding around the lowest drug concentrations in breast milk, could provide viable solutions. This method would require precise monitoring and could offer a compromise between continuing effective cancer treatment and providing the benefits of breastfeeding. Such innovations could set new standards in the treatment of breastfeeding cancer patients, significantly improving both mother and child health outcomes. Support networks play an invaluable role in helping mothers navigate the complexities of cancer treatment while breastfeeding. These networks provide not only emotional support, but also practical advice and connections to resources such as donor milk or supportive counseling. Organizations like Breast Cancer now offer support groups and hotlines that can help mothers feel less isolated and more empowered in their decision-making. Internationally, the approach to managing cancer treatment in breastfeeding mothers varies significantly. In some countries, extensive support systems and healthcare policies provide robust support, while in others, mothers may face this challenging journey with minimal guidance. A comparative look at global practices can provide valuable insights into more compassionate and effective healthcare frameworks. Until more definitive research is available, it is crucial for healthcare providers to engage in open, informed discussions with patients about the risks and alternatives. Recommendations might include temporary cessation of breastfeeding, use of donor milk, or formula as alternatives to ensure the infant's safety. Healthcare providers must also consider the psychological impact of these recommendations on the mother and offer appropriate support. The intersection of cancer treatment with maternal roles such as breastfeeding presents a deeply complex issue that requires thoughtful consideration and action from all involved: healthcare providers, researchers, and support networks. Ensuring the well-being of both mother and child while navigating these challenging waters is paramount. As we advance medically, it is crucial that our empathy and support for patient experiences advance equally. As a society, it is our responsibility to push for more research into the effects of cancer treatments on breastfeeding, to improve communication between healthcare providers and patients, and to bolster community support for affected mothers. Let us advocate for healthcare practices that not only seek to cure but also to care, ensuring that maternal health is preserved without compromising the quality of treatment. This is not just a medical issue, it is a matter of compassion and the right to informed health choices. Imagine being thrust into a battle on two fronts. One, a fight for your life against cancer, and the other, a fight for the best start to your child's life through breastfeeding.